This program was produced by and first broadcast on Radio Hawke's Bay, your community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Two, 1, 0. Good morning, everybody. This is Heiko from the Acupuncture on Air show here in Hawke's Bay. And, well, I should say sunny Hawke's Bay, but it's pretty sort of cloudy today. We interview acupuncturists from all around New Zealand, but also around the world. And as I've mentioned in the past, we've had people from Australia, from America, and now we've got our special guest, Dr Carolyn Eddleston from the UK. Good morning, Caroline. How are you?
Good morning, Heiko. Well, good evening, and thank you very much for this opportunity for being on the show again. It's great.
Yeah, so this should be an interesting show because, it's a bit of a conundrum because, we're always talking about heat associated with menopause, but now we're going to be talking about sort of, which I know I've had many women have, where they have night sweats, and then they also have chills. Now, and many women get a combination of this. So can you tell us about the night sweats and why this is a problem during menopause? And again, is that decreasing estrogen?
Well, it's a good question. So there's no doubt that the thing that all women have to deal with is the fact that their ovaries stop working and the estrogen levels decrease. And most of the menopausal symptoms are because of decreasing estrogen. However, when they've measured estrogen, as we said in one of the earlier programs, some women have relatively higher estrogen even though the levels are dropping and terrible hot sweats. Other people have incredibly low levels of estrogen and no hot sweats at all. So something else is going on, isn't it?
Yeah, and so and in Chinese medicine too, it's what I've experienced, I mean, we might talk about this a bit later, but, when I can have a patient that I've seen, before menopause, and they're classically very yin deficient, and you think, oh, geez, when they get menopause, it's going to be really bad, but then it's not, But if we're just using Western medicine, is there any treatments from a Western medical point of view that they use to address the night sweats?
In this country, it may be different in yours, but there's only really two things that they use. One is HRT, the hormone replacement therapy, which is giving the body external estrogen and progesterone. That definitely seems to help a lot of women's hot sweats. And the other thing is something called clonidine, and that seems to affect the blood vessels. So what happens with the hot sweats, and they've done some good measurements, is that the threshold for sweating, so the level at which you sweat, seems to come down. So it doesn't take much for your body to sweat, and it's the same with the chills. It's easier to get cold and be chilled. So this clonidine seems to affect the blood vessels, and that seems to help the sweat. But there are side effects of both of them, which is obviously the problem.
Okay, now, night sweats in Chinese medicine, again, there's a number of different causes, both chronic and acute, such as we say the kidney yin is weak from a chronic cause, or an acute fever can give you night sweats. But in your experience, Caroline, what is the most common traditional Chinese medicine pattern and, with menopause and night sweats?
Well, obviously, some of the terminology we use in Chinese medicine doesn't make a lot of sense. So I'm sort of going back to basics. If we think of most people have heard of yin and yang. If yin is relatively cooler and yang is relatively hotter, I would say the most common thing I see is the kidney yin, the cooling aspect of the kidney is reduced. And our kidney energy, as you know very well, reduces as we get older. And, of course, our excessive lifestyle, we tend to deplete it even further. So I think most of us in the Western world are relatively kidney deficient, which starts you at a level where you are going to get the sort of yang appearing to be hotter.
Yeah.
So you're feeling more heat. I would say that one. And then with the stress, blocking the liver flow in Chinese medicine, it doesn't like, that organ doesn't like stress anyway. And then because that stagnates, you get this fire rising up. So I think those two are probably the most common ones I see. Would that be similar to you?
Yeah, I mean, I have to say that, but I just find that patients generally, they're always overlapping with other problems, and I think it's, bad diet, no exercise, irregular lifestyle, they have spleen deficiencies and damp, and they're always like mixed in with the major ones, so you sort of end up, you treat a number of things. And I know many acupuncturists, they use an acupuncture point on the inside of the calf called spleen 6, and another one on the wrist. It's on the heart meridian, which is used to treat night sweats. But what about you, Karen? Do you have any unique acupuncture combinations that you work on for the night sweats?
Yeah, I really do treat the individual. So a lot of people have their sort of favourites, but I'd say for night sweats, I often use a point on the inside of the ankle, kidney 6, and I use the calming Shen Men point, heart 7. So I quite like this. You're sort of treating the fire and water of the body, and then sometimes I put that lovely point in the top of the head, do 20, but I point it down. So I'm trying to pull energy down from the head.
Okay.
That anxiety and the yang coming up, I'm trying to kind of push it down the other way. And then also, I like treating the actual kidneys on the back points, actually just waking up the kidneys a bit.
Yep, good. Now, I know that, about women, they get alternating night sweats and chills. Now, from a Western medicine perspective, why the chills as well? Because they say that can affect sort of 3 in 4 women getting these chills.
Well, this is what I'm reading about and hearing about are these new studies where they're realizing it's not just as simple as the estrogen. Something's happening where the threshold that you'd normally sweat and the threshold where you'd normally feel shivery and chilled if it got really cold, that's narrowed. So people are getting hotter more easily and colder more easily. Something's happening to the blood vessels in the skin, I think. Some things, where they're in sort of heightened adrenaline alert, there's been some studies that have shown more adrenaline-type hormones in the brain that are activated with menopausal hot flushes. So again, they're finding these things, but nothing seems to be very, very
concrete.
Cut.
Yeah.
Yeah.
And Chinese medicine, I mean, why the heat as well as the cold?
I haven't really worked that out. I don't know whether you have. I think what I've noticed is it tends to depend on their constitution, on how they were before, and what lifestyle they've led before. So somebody like me, I really, really feel the cold, and I'm menopausal at the minute, and my hot flashes aren't so bad. Now, I think that's because I'm so blimmin' cold anyway. I quite enjoy a bit of heat.
Yeah.
It was the same when I was pregnant. Whereas if I'm really hot constitutionally, you add in a bit of kidney yin deficiency, I'm going to feel a lot more heat, I think. So I think there's that as well.
Yeah, well, I've looked at the dual, the conundrum of having heat and cold, and what I believe is it's a mix of kidney yin and kidney yang deficiency.
Yes.
And again, for our viewers, modern medicine tells us we have 2 kidneys, which we know they're in the back. But Chinese medicine say that they're actually different. We say one is yin and one is yang. One is water and one is fire. Do you think in one day with modern medicine is that there ever will be different functions associated with the 2 kidneys?
Well, I always loved, the reason I love studying Chinese medicine is I could see some connections that Western medicine was beginning. They couldn't explain it, but they saw connections. And I can explain that with Chinese medicine now, and that helps. I think it's going to have to get better at measuring the subtle. And I don't think Western medicine is nearly subtle enough to measure what we're actually doing in acupuncture. It would be lovely to say yes, but I'm not convinced at the moment that they're subtle enough.
Now, I know that you yourself, you do meditation and you practice Qigong. Qigong is this sort of like a Chinese, for want of a better, a moving, relaxing meditation. Now, and there are specific postures to help with kidney energy. Do you recommend have any courses that you have for your patients in the UK teaching Qigong?
Yeah, I do. So what I do is I instruct a sort of cultivation technique for people to sort of strengthen their internal energy, and that helps with all sorts of symptoms. And also there are Dao Yin prescription exercises for certain organ systems. So with the menopause, I'll often instruct people in the kidney Dao Yin, which is a very simple movement just to really strengthen the kidneys. And I think it's just a mindfulness meditative practice as well, isn't it? Where you're slowing down, you're focusing on the breath, you're in the present moment, and all that, I think, helps in our frantic lives, really.
Yeah, because we're quite lucky in the Bay too, because we do have one guy here, a Qigong teacher. He's also a martial art instructor, but he does teach short courses in Qigong, so I'm lucky that I can refer my patients to go over to him. But listen, we're coming up to the end of the show again, and you're probably getting ready to put your pajamas on. And but thanks very much for coming on the show and finishing this first series of on acupuncture and menopause. And I'm hoping for the rest of the year that we can do sort of one show a month and talk about some of the different aspects and the different symptoms of menopause. So we look forward to seeing you next time.
Yeah, thank you. It's been really, really interesting, and I think there's so much to talk about, and perhaps at some point we could talk about hormone therapy, the pros and cons, and all the other options that we have available. That would be really interesting. Yeah,
and particularly I know that quite a number of women, they have concerns now about, hormone replacement therapy, and so that would be a great topic that we can maybe do on the next run. So thank you again for that, Caroline. And I'm sure a lot of interest will come up over the year. And we'll see everybody on the next show. Thank you.
This program was produced by and first broadcast on Radio Hawke's Bay, your community access media station. Thanks to New Zealand On Air for making this type of programming possible.